much, Aydogdu, and welcome to Tell Me. With more than 40 million confirmed cases and over 1 million deaths, coronavirus is spreading globally. Now, a second wave is confirmed by many countries. The first time round it was unprecedented, the countries were unprepared, and we were all struggling to understand what was happening. Now, authorities were trying to find ways to slow down the virus, and it brought to light the weaknesses and strengths of countries. Now, countries introduced different measures, restrictions, aid packages, but the question is, was there a global response? And have we learned from today when we look at everything? So on Tell Me Today, you, our viewers, have shared with us your opinions and views, how you're impacted and how it's affecting your lives, and also whether you're fed up with lockdowns or you're looking for tougher restrictions. And joining me on the programme to talk about this today, Professor and Director of the Institute for Population and Health at King's College London, and formerly the Chief of Health Policy at the World Health Organization, Kenji Shibuya, and Professor of Sociology, Ellis Cashmore. Thank you very much, both of you, for joining us on the programme today. So, Kenji, starting off with you today, so let's hear from you on a global perspective how the second wave is looking worldwide compared to first.
So obviously, we're in the particularly Europe and the United States, becoming in the middle of the second wave. Compared to the first wave, I think partly because the testing capacity has expanded, so the cases, particularly those found among young and asymptomatic cases, are growing, and also so as the case fatality is seemingly declining. But in terms of the impact, it's much more severe compared to the previous, and so we have to be very careful.
Okay, well, as we said, many have shared with us actually worldwide how it's impacting their lives. So let's watch, first of all, from a positive point of view from Australia, Yasemin.
Hello from the Australian state of Victoria, where COVID-19 cases are in the lower single digits for the past 10 days. On Monday and Tuesday, it was 0. If you think that's impressive, some states haven't seen a single case for months. Still, I feel like I'm living in a utopia right now compared to the rest of the world. I feel relaxed. Today, there were only 3 new cases in Victoria, 9 cases total for Australia. But we've been through a lot. When the pandemic first started, Australia was one of the first countries to shut its borders. There were very few cases coming from overseas. They were held in quarantine. Things changed early in June. It was then we started to hear new cases here and there. As many around the world know, it didn't take long for a few cases to turn into hundreds. When we reached over 500 cases a day on average, a complete shutdown was declared. First a state of emergency, then a state of disaster. Everything except clinics, chemists and supermarkets were closed. It took close to 3 months for daily cases to decrease to single digits, which is when the government started to relax things. But it took a toll. The government has invested a lot of money to psychological support. Since yesterday, we can't go out without a reason. However, everyone knows it can come back. It still isn't totally gone. Until a vaccine is found, we all know even our partial freedom is at risk, unfortunately.
Now, Ellis, let's bring you in here. Now, this is a country which introduced tough restrictions and measures and complete lockdowns and state of emergency. It wasn't as easy for Australians, but looking at today, they have achieved which many countries haven't, and for now, they have suppressed the virus. So what do you think about the way Australia handled things?
Well, they handled it in the exemplary way, I suppose. They acted quickly and decisively. But it caused tremendous inconvenience to Australians. And I think the rest of the world looks at Australia and says, well, it's a big country, but they haven't got a big population. And they're kind of different demographically from most other parts of the world. So they're really, I won't say disembodied, but they are a different case. The rest of us, particularly in Europe, are still struggling, as we all know, of course. I sense that Australia is seen as a kind of a country apart. We in Europe and for that matter, the Western world, I suppose, is now facing arguably a tougher test than we had earlier this year. I think there was a degree of compliance because people felt in the spring and the summer that they're all pulling together in the face of a common foe. It was something to be defeated, and people were willing to make the sacrifices, surrender their personal freedoms, and put up with all manner of inconvenience in the hope that something would work. And of course, now they faced the very uncomfortable reality that it didn't work. And what have they been asked to do? Repeat the whole process. And that's why I think the consensus is now breaking up.
And you think that's in the case of whole Europe, how Europeans feel?
Broadly, a similar process. I know that France and Germany are reenacting lockdowns with more severity than Britain, for example. But of course, there are always rumours that a British lockdown is just around the corner. So I am kind of making blanket statements, probably unjustifiably, and I think there are nuances in the differences in response across Europe. But I'm trying to be global now and look also at the United States and, for that matter, Central and South America. I really do feel people are now saying, we have made the sacrifices, the lockdown didn't work, so why are we being not only asked, but instructed to obey people who really don't know what they're doing? I think there was a faith initially in the so-called scientists and medical experts who were making pronouncements and instructing governments on how to behave and make their policy decisions. But now I think the skepticism is growing day by day, and people think there is no one in this world who really knows about how this coronavirus is mutating and how it will spread throughout the world in the months and years to come, perhaps. And you know, it pains me to say this, but I do sense, just talking to people, I'm in the UK, as you know, but just simply talking to people, that there is almost a resignation that this is a virus against which we have no weapons. We just are not equipped to deal with this. And until a vaccine comes along, we just can't do much about it. So perhaps we should learn to live with it.
Well, let's see then what Najma thinks out of the US.
Hi, my name is Najma Emrakel, and I'm going to touch base on how COVID-19 has affected me mentally as well as economically. So when COVID first hit, I was working for a clothing company and they closed down due to COVID. And so that meant that I was laid off from work for over a month and a half. So that definitely took a toll on me. And mentally, I'm still not able to see most of my friends that live on campus, like in dorms, just because of all the rules and regulations that campuses have set of like who can enter the dorms and who can't. So I definitely miss them. And most of the time, I'm always thinking about when COVID is going to be over, if things are ever going to go back to normal. So these are just thoughts that are always in the back of my mind. And speaking of restrictions, I am definitely in favor for them, just because I know that they're in favor of us. And personally, I believe that it's nothing political. It's nothing that's not something that we can't handle, just because they're strictly for our safety and to stop the spread or slow down the spread of COVID-19. So yeah, thank you so much.
Kenji, so Ellis portrayed quite a harsh picture there, and whether it's the truth or not, we don't know, time will tell. But as to me, I've been in isolation for 7 months as I'm in the vulnerable group, and I don't feel yet safe enough to go out there. But he said lockdowns didn't work. Do you share that point of view?
Yeah, I think there is a clear evidence that lockdown didn't work to disrupt the transmission in the first wave. And with the lockdown, we could have more casualties. And in terms of the second wave, we have much more clear picture about this virus, particularly the important role of asymptomatic transmission and also possibility of reinfection, and also the long-term consequences of COVID, which is called long COVID. So I think people are saying that let this virus transmit in the community and let them acquire herd immunity. But the possibility of using herd immunity is not necessarily scientifically valid from the evidence from across the world. So the basic strategies which we learn from particularly Asian Pacific region, is that we should carefully implement border control and also universal mask, and also implementation of expanded test, trace, and isolate strategies to avoid the lockdown. But in the case of Europe, after lifting lockdown of the first wave, because the summer vacation, open up the air travel, so eating out campaign, and also school opening up, and also, of course, the autumn comes in, all these factors contribute to the resurgence and the flare-up, and then the second wave of transmission. But we know how to suppress as promptly as possible. So we shouldn't be so pessimistic about how to cope with this virus and maintain the economic activities and avoid the lockdown. So to sustain by suppressing the transmission as early as possible.
I will come to that question, how can we suppress the virus and the transmission, but let's first carry on with Kamal, who's sent us a video from Netherlands.
My name is Komal and I live in Amsterdam together with my husband. My day job is in financial services consulting and I'm also a blogger by hobby. In terms of the impact of the coronavirus, our first wave sort of got better around June and life began to go back to normal, of course, with restrictions attached. I was going to the office twice a week around August, and then September is when we were hit with the second wave. The second wave is much worse in terms of number of infections that we had even at the peak of our first wave. So naturally we are in a second lockdown now. Restaurants and everything is closed. We are completely working from home. A lot of people are impacted. My husband and I are privileged enough that we have permanent contracts with our employers, so financially we don't see a big impact on our lives, but otherwise, of course, every other aspect is currently being guided by the restrictions and a semi-lockdown that is in place in Amsterdam.
Ellis, so it's affecting many people in different ways, and economic, of course, financially, mentally, it's taking a toll on people. And you said in an interview recently that looking at the scientific advice given, especially in the UK, they are designing something they want to see happen, not necessarily observing the world around them and responding to it, but designing it as a lab experiment. What do you mean exactly by that?
Social distancing obviously will work if it was implemented in a kind of test tube way. In other words, it's obviously common sense. If you took every individual and compartmentalized them and prevented them from interacting with other human beings, then you're not going to get any transmission. That would be perfect self-isolation. But the real world isn't like that. We live in a society where people engage with each other, communicate with each other, rub shoulders with each other. It's a living, moving, organic phenomenon. Society will not be controlled as if it was a laboratory experiment. That's what I meant by this. And no matter how much any political leader lays down the rules and says you must not move out of your house, or you must not rub shoulders, you must not talk to people, you must not visit relatives, people are still going to do it simply because they're human beings, and that's what we do. So I think that the rules do have a capacity to restrain us, but not control us. And that's what I mean when I say that there's a disconnect between what politicians want from us and what we are prepared to give.
Well, let me bring Kenji in here. So, Kenji, do you think that they don't yet know enough about the virus? And if we think about societies and these restrictions feel too much for the people, is it because the authorities haven't done enough when it comes to test and trace system or in reducing the transmission?
Yeah, so after 9 to 10 months, we have pretty much clear picture about the role of asymptomatic transmission and also risky environment. Particularly Asian countries, they adopted the strategy to avoid this risky environment and expanding test, trace, isolate strategy very quickly, and of course the universal mask strategy. They suppress substantially, and they avoided lockdown, particularly in, for example, South Korea or Taiwan, and of course, they maintain economic activities with limited cases reported. So there are potential ways to cope with this virus, although there seems to be a balance between economic activities, people freedom, privacy, versus public health and draconian interventions. But of course, depending on the society, we may need to adopt different strategies. But the basic strategies are there. And it's a matter of whether they will implement swiftly or promptly or not.
But Kenji, let me ask you a question. You say the strategies are there, but the strategies are arguably causing more problems than the solution. In other words, there are people, the cancer patients who are waiting for treatments. There are people who are involved in road accidents who are not getting priority. There is tremendous mental health problems that are spiraling out of control. Domestic abuse has increased. There are so many other problems. And I've not even got onto the economic problems of people losing their jobs and mass unemployment just around the corner. What I'm arguing really is that our strategies may be stemming, not completely obliterating, but stemming the transmission of the virus, but at tremendous cost to other aspects of society.
The purpose of the lockdown, again, the A is to prevent the collapse of the overstretched health systems, overstretched bed capacity, to accommodate other, for example, cancer patients or casualty of injuries. So without proper measure at this time, particularly at the time of exponential growth, we cannot even help these patient other than COVID patient. So I think, as you say, we need a balance. But unless we stop this transmission very quickly, we have more casualties.
Well, let's now watch another video. Of course, we want to share as much as we can from our viewers who've sent in and how it's impacting their lives. So this is also Yasemin from Istanbul.
Hi, this is Yasmin from Istanbul, and I had good dreams at the beginning of 2020. I was getting married. I have quit my job, and I was going to do my dreams, and we were moving a different country, but at the beginning of March we have strongly met with COVID-19, and we stayed at home. We cancelled everything. We had to stop, of course, and then I have learned that you need to have always a plan B, because you can of course reshape your life, but you need to have different plans for life. And I experienced also 28 days COVID-19 positive, and I was quarantined and fed by my fiance, and it was very different experience. I only felt a headache and loss of smell. It was the easy way, I think, for this virus. I hope everyone experiences this virus as same with me.
Hola Ayca, pues ahora vivo en Madrid y aquí desde el último mes hay un poco de confinamiento a nivel de zonas sanitarias. Y aunque no es toda la ciudad, sí que está por distrito según haya más incidencia o no del coronavirus. En cuanto a mi trabajo, afecta realmente porque ya sabes que me dedico al cine como director y productor, y la incertidumbre está ahí, y eso es un problema para cualquier producción porque no sabes si la vas a poder llevar a cabo o no. La ley realmente está favoreciendo los rodajes, está dando todo tipo, desde el Estado, están dando todo tipo de información para poder trabajar de una manera adecuada en cada rodaje, pero hay miedo en cuanto a que si en un rodaje sale cualquier tipo de positivo en coronavirus, si hay algún rebrote, eso es una mala imagen para la producción, para el rodaje y para todos los que conformamos el equipo, ¿no? Por lo tanto, entre la incertidumbre y un poco el miedo, está complicado volver a grabar, aunque hay que intentarlo y habrá que seguir grabando. De hecho, yo voy a seguir con mis proyectos, pero eso no quita que sea con miedo y con cierta incertidumbre. Está la cosa bastante difícil, la verdad.
Ellis, now we've seen their lives impacted in many different ways. For example, in terms of Yasemin, she was going to move countries, start a new job, get married, couldn't do any of those, had to stay put where she is. And then in terms of Gabriel Cabi in Spain, he is a director and he's being told, go on set and film. But then again, if there's a case of the virus or if there's an outbreak on set, well, you're left with the decisions and consequences yourself. So, when you were talking about people being, as I can see also from yourself, that people are very frustrated in terms of these restrictions on lockdowns, if the authorities were doing what they are conveying the right message, or in terms of the test and trace system, in terms of other measures, or the health system being, in top priority, would you think that we would feel easier about these restrictions and actually do what is necessary because we would know that the authorities are doing also what the best they can? Are we being felt let down?
No, probably you're probably right. If there was a direction or plan, a design, something, an overall goal, then I believe that people would be prepared to put up at least somewhat more with the consequences. But the problem is, first, there is no global strategy. No matter what anybody says, different countries are reacting in different ways. And my best knowledge is, of course, from the UK, where I live. And we have a leader who seems to be changing the goal. First, it was to save the National Health Service. Then it was to rid ourselves of the virus. Now we don't know what's going on. So there is no overall ambition that we know about. And I think that the suspicion has grown now is that the reason why we don't have an overall ambition is because we really don't know what we're doing. And in a sense, you have to be sympathetic with world leaders. They are grappling with a phenomenon, an unseen phenomenon that historically has no precedence. We have other viruses and we have other plagues to look back on in history, but there's never been anything quite like this. And so with the unpredictability factor, I think that people are prepared to go along with governments to a certain extent. But for how much longer, I don't know. I don't think that we've seen sporadic outbreaks earlier this week. Of course, we saw, I suppose, outright civil disobedience in Spain and Italy. And I'm wondering if that is, I'm not going to be a prophet of doom and saying we're going to see disorder on our streets, but I'm just wondering how long this fragile consensus, and it has become very fragile over the last couple of months, how long this is going to hold.
Okay, well, we have now another video. This is from Christelle in Beirut.
So Lebanon is facing a lot of difficulties. People are going through so many hardships, and the economic situation in Lebanon is very dire. But it's not because of COVID-19. What we're going through is the result of so many political issues and instabilities in the region and in our own country that have been going on for more than a year now. COVID-19 just happened to make things and matter so much worse, and actually 100 times worse. During the first wave of coronavirus, we had very tough restrictions, and we had a total lockdown, after which so many businesses were forced to shut their doors for good because they could not sustain and maintain their businesses. Now with the second wave of COVID-19, things loosened up a bit. We do not have the same restrictions anymore, but the damage has already been done to most of the Lebanese businesses and people.
Kenji, when we think globally, we have to, of course, consider every countries where there are conflicts, where there's political instability, where there's poverty. So has there been enough done, do you think, in terms of international effort to tackle this globally? And do you think the only hope left is vaccination? And how hopeful do you feel about that? And especially being distributed to all countries?
Right. So the vaccine are kind of under development, so we will see more clear picture of it soon. But I don't think the vaccination alone will solve the problem, because we may not have enough vaccines, and also the efficacy of vaccine may be limited. On top of that, we don't know whether or not the vaccine will prevent the transmission. So we have to also continue this kind of, how to cope with this virus, and how to suppress as much as fast, and also how to maintain economic activities without lockdown measures. So there are lessons from Asia and other parts of the world. And also, I think WHO has been consistent to suppress the virus and expand the test from the beginning. Although, for example, wearing mask, border control issue has been changing. But I think right now we have a clear picture that we have at least 3 control knobs: border control, social distancing, wearing a mask, and of course, we need to expand test trace and isolate strategies as much as we can. And in terms of global solidarity, it is happening, particularly, for example, vaccine distribution. WHO, Gavi, and CEPI have developed so-called COVAX so that we can reduce the price of vaccine to be distributed in least developed regions as many as possible. So there is ongoing solidarity and global collective action to support particularly most vulnerable population and least developed regions as well.
Well, as someone who is in the clinically vulnerable group, I do hope for vaccination. That feels my only way really to go back to my old life. But thank you so much for joining us on Tell Me today, Kenji Shibuya and Ellis Cashmore. And that's it from us on Tell Me. So do share your views and opinions with me to my Insta account, ChaChaI, and do stay safe and sane until next week.